ma'am has told so much about the anemia, and even Dr. Deepti Nag, that we are actually aware, and we have to hammer ourselves repeatedly that we have to create this awareness amongst the society. So now I am coming to the medical legal aspect, because that is also very, very important, because this time we are more socially inclined, but actually we should get inclined towards ourselves, that what all anemia can cause to you, to patient and baby, and then of course to you. So this is the first slide, is the same slide which ma'am has presented, and she really explained it very well. You understand that it causes work performance, child development, school performance to a lower level, and mortality is in severe anemia. So where it comes the question of mortality, there you have to think of the medical legal litigation, and that's why you have to be very, very careful in such cases. So I am starting from this. What are the causes of litigation in anemia? Failure to diagnose anemia in pregnancy, especially in first trimester in book patient. So all the book patients, it is your sheer responsibility, not only once check hemoglobin and then forget about it, but keep repeated testing, so that you are educating them also regarding nutrition and everything. And then failure to prevent severe anemia, because once you will do the hemoglobin every time, and you will take care of it, and you will give the measures, then of course she will not turn into the severe anemia, which is a real problem in medical legal cases. Failure to address underlying cause is very important. Anemia may be secondary to serious conditions like malignancy or chronic diseases. Failure to investigate and manage these causes can lead to litigation. However, care must be taken not to miss other causes of anemia, such as sickle cell disease or other hemoglobinopathies. Because once we talk about 90% anemia is because of the iron deficiency anemia, we have to keep this in mind, that thalassemia and sickle cell anemia is also very important, and that also can lead to litigation. So take care of that cause of anemia. Even sometimes they are not anemic, even then there is you have to test for these hemoglobinopathies, because that can be a very important issue. Failure to refer to expert to correct diagnosis unexplained anemia. And in many patients, we are giving iron, we are giving folic acid, B12, inform me कर दिया, लेकिन hemoglobin बढ़ ही नहीं रहा है. In such cases, you must take opinion of the hemoglobin, at least once. Because if there is such cause which we are not able to find out, at least it has to be worked out. Then failure to manage according to standard operating protocol. So once we follow the guidelines, we are safe. Failure to do timely blood transfusion or IV fluids. Failure to take consent for blood transfusion, that is very important. Failure to communicate to patients and relatives of likely complications. Because as I have told that हर पेशेंट जो आपकी बात नहीं मान रहा है, उसको कन्विंस करना ही पड़ेगा कि भाई अगर तुम नहीं मानोगे तो क्या क्या कॉम्प्लिकेशन हो सकते हैं. Only then they will listen. अगर हमने बताया, उन्होंने नहीं सुना और they landed up with severe anemia, even then the responsibility is ours. So हम लोगों को कोई भी छोड़ना नहीं है, कोई भी पेट वाटर, and we have to convince them to do their hemoglobin. Failure to notice any reaction or complication during blood transfusion. Failure to take their consent regarding this communication. You have to note down also in the paper that we have consulted the patient regarding the diet, then it becomes a responsibility. Then failure to do improper monitoring during labor, delivery or anesthesia. Failure to counsel about FGR, delayed milestones of neonate and future device to severe anemia. So we must tell them that look here, अगर आपका anemia prove हुआ तो आपको यही हो सकता है. Failure to diagnose potential for cases of PPH and preparedness for that. Failure to notice cardiac decompensation during antenatal intrapartum or postpartum. So that is another aspect of it, that you have to, because any patient can land up in PPH. So if patient is anemic, then of course the result is more devastating. So it is very important that no anemic 10 gram less than 10 gram hemoglobin patient should not go in the field. That should be the data. So it's not only intrapartum antipartum, but also the post part. The most important cause for litigation is unprecedented preparedness in dealing with such cases. So you must take care of all the unbooked cases because there it is the problem because sometimes you don't know the hemoglobin or it came in the liver or something like that. Then you have to really be conscious about this fact that any other patient can have coincidence. So informed consent is very important. Patient have the right to be informed about the risk and benefit of treatment or lack thereof. If a provider fails to adequately inform a pregnant woman about the risk of anemia, and this failure leads to harm, it could also be a basis for litigation. Expectations from an obstetrician is to one. We all know that whatever we, how much care we are taking, even if the slightest fault or such like that results really give us very bad. Physicians are expected to meet the standard of care in diagnosing and managing anemia. Deviations from established guidelines, WHO or national protocol, any of the need to proper documentation, patient education, adherence to clinical guidelines, and effective communication of official communication basis. Do not miss history and examination. It's not always that we just get the test and we forget about everything. But we have to really notice, even in unbooked patient, what are the signs of anemia, and you should notice all those things. We need, you all know the clinical signs, so I am not going to do that here. But a patient is weakness, shortness of breath, dizziness, and pain is another feature of severe anemia. So that should not be missed. And we know that as an observation, patient enter करते ही हम समझ जाते हैं whether she is severely anemia. Investigate properly, complete blood count, including all the yeah, that's it. Soluble transparent receptor serum iron and total iron binding capacity. Ferritin tells about the stroke and iron tells about the current iron. Serum erythropoietin peripheral smear is very important because peripheral smear will tell you about the iron. Differential diagnosis of thalassemia and iron deficiency anemia is of great clinical significance. Benson plates is also very important. And as you know that if it is more than 30, it is iron deficiency, less than 30, some hemoglobin. So preventive strategies developed by WHO compromise comprise of food-based approach, iron supplementation, improvement in health services, and sanitation. Other strategies, example, control of hookworm, malaria, parasitic infections are also required to prevent IPA. So it is the severe anemia which is the culprit. So I'm going to talk about severe anemia, and I'm already told that it is only 2-3% now, which used to be 8% in 2020. So we have reached somewhere. So how to triage a patient? It is the same thing almost. Diagnosis and booking, special attention to unknown patient, proper investigations, finding underlying causes, follow with repeated tests, dietary advice to exercise, daily iron folic supplementation. Do not divide an ingredient in hemoglobin of at least a patient. So you have to be very careful. It's not only that hemoglobin is less and so you are counting. You have to get the serum corrected. If it is high, no transfuse iron. Management according to stage of pregnancy, IV iron not recommended in first trimester. Counseling and documentation regarding modality of treatment and consequences. Iron infusion blood transfusion according to need. Avoid fluid overload in patients. Detection of high risk factors, susceptibility to PPH, deworming operations, after first trimester, delay in umbilical cord family after therapy, to increase the blood implementation of the baby. So now I come to the severe anemia, what aims we should follow. Address underlying cause and restore normal hemoglobin level in the In severe cases, anemia can lead to complications such as heart failure, arrhythmias, and organ damage. Preventing severe anemia should be the goal. So, of course, if the patient is low, then there is no reason to be that the patient is severe. On first visit, diagnosing and treatment should be the policy. Consequences of severe anemia should be explained to patient and familial documentation is must. So these are the few indicators that quickly go through. If hemoglobin is less than 5 gram per cent without the sign of cardiac failure, in the patient with less than 34 of pregnancy, then plasma transfusion is must. If hemoglobin is between 5 to 7 gram without cardiac decompensation, then also transfusion. In a pregnancy more than 34 weeks, if hemoglobin less than 7 gram, you have to take transfusion, and severe anemia with decompensation is always a indication. And you are not using metabolic deficiency, you have to find out that patient is not having chronic infections or something, chronic diseases which are leading to this thing. So that before giving blood transfusion or IVF, it must be clear that what is the cause for severe anemia. Hemoglobin factor or bone marrow failure symptoms to be diagnosed by sending to the experts, and psychologists should always be consulted. That is a very, very important thing to save yourself. If any patient was severe anemia and you are not able to find out the cause, please send her to the oncologist for it. Intrapartum period is also very, very important because if there is less than 7 gram hemoglobin, even patients during labor must take a blood transfusion. Decision of blood transfusion depends on medical history or symptoms. And postpartum period, anemia is sign of shock and contain sign of hemodynamic instability. Hemoglobin less than 7 grams of platinum, decision of blood transfusion depend on medical history. A proper informed consent for blood transfusion is must. What I do in all my cases, I do next coming morning, whether it is a normal delivery or cesarean, for a CBC in the morning. If it is less than 10, usually I is the most and also patient goes home with a little better iron content, and she gives better injection, more energetic. So precautions taking during blood transfusion, that is also a very important factor for utilization. That should be compatible, that should be free from contamination, that should be free from blood diseases, that should be fresh, less than 2 weeks storage, high hemoglobin content. Precautions while treating anemia, be careful of reaction, fever, rejection, injury, destruction of red blood cells, nuances, graft versus host infection, and complication of acid transfusion. This all should be kept in mind because these are the things where you can fall prey to irritation. Labor brings tragedy. Intensive monitoring of vital signs is the key. Prophylactic antibiotic, antibiotic pain management should not be done, neglected, and good documentation is must. So no booked patient, booked patient should go labor with severe, and that is the data we all have to follow. Unknown cases should be thoroughly investigated, diabetes should be conducted, ENT should be conducted in tertiary care center as far as possible with availability of blood bank. Because I have gone through many cases, medical legal in Bangalore, and I know that this was a very important factor for energy, that was not available in the hospital or it was not available in the near vicinity. This was a very important factor. Blood grouping and cross-matching is also important because this was also another factor that the patient was actually AB positive, but she told the doctor that I am B positive. And then they got her blood for B positive blood, and then cross-matching was done and it was AB positive. So and this patient actually died. So this was a very important factor in our support that how the doctor did not know who he was. So just don't trust even Cloud9 and NAS also. They got a written report of blood group. Don't trust. Please don't trust that the patient said my blood group is A positive or B positive. No. You have to get whether it is to be done twice or thrice, you have to get the ensured IV iron blood transfusion according to gestation and severity. During labor, knowledge be careful about compensation and fetal death well-being. Third stage is very, very crucial. Preparation for anticipation of BPH, all oxytocins, prostaglandins, everything should be available in the labor room. Again, same thing, availability of blood to be ensured. It is statistics to be taken into. Documentation of each and every event to be done in file with the accurate timings. Support team should be available. A second observation may be available in the case of first scenario. Patient and her relative will be considered only and written and informed consent for blood transfusion and any of the complication. So immediate postpartum period is also equally risky. Intensive monitoring is continued in postpartum period. First, medical respiratory constants and ventilator periodically. And with this, measure to prevent sepsis are important. Antibiotics are continued for several days. Full amount of antibiotics should be given in any such cases where something like pneumonia is better or patient that fall in the crisis. Since these patients are at high risk for embolism, anticoagulation is advised. Record maintenance is must. So, the severe anemia pregnancy can lead to serious complications for both the mother and child. And in some cases, these complications can result in medical malpractice litigation. It was negligence or failure to properly manage the condition. And the diagnosis and appropriate management of anemia preventing adverse outcome. What are the mantras of preventing litigation? Anemia is not especially severe anemia. The diagnosis of anemia is directly involving as fast as possible. Be careful while giving blood transfusion or IVIL. Counseling and documentation is necessary. Labor monitoring and third stage management should be done. Imperium should not be occurred. So this is a panel which says that the child is born and the doctor has patted it and he said it is a malpractice. So this is the kind of situation nowadays and everyone is indicating towards doctor only. So we have to save our skin. And so this is another pattern which says, sorry, Dr. Albert left our practice and is now making more money selling malpractice insurances. So this is a nowadays, and we should really take care of ourselves.